Isang magandang araw. Una, nais ko magpasalamat sa lahat ng organizers at sa lahat ng bumubuo ng seminar na ito. Isang karangalan para sa akin ang maimbitahan at maging bahagi nito. In this talk, what we're talking about is not only the most interesting but also the most relevant field of nursing during COVID pandemic. And let me start by sharing you my slides. I was given the task to talk about travel nurse, a fulfilling role amidst staffing shortage brought by pandemic. Aside from the basics of travel nurse, I will discuss or share with you the different elements and different scenarios that happened during COVID pandemic involving travel nurses like me. But before that, let me share you a bit about myself. I graduated with Bachelor of Science in Nursing sa pamantasan ng lungsod ng Maynila in 2009. Naghanap ng trabaho, hindi pinalad, and then I worked as a volunteer nurse sa Gat Andres Bonifacio at sa Mother and Child Hospital sa Manila. After 2 years of unemployment, I decided to move to Norway where I worked as an auxiliary nurse mula 2012 hanggang 2020. During that time, I studied nutrition and healthcare service noong 2017. And for me to get my license as a nurse in Norway, I had to undergo supplementary education for non-EU nurses noong 2019. So, medyo mahaba yung process at ikukwento ko na lang siguro in another time. Pero it took me almost 7 years to get my license as a nurse in Norway. Pero itong course na ito, it was just a 1-year program doon sa Oslo Metropolitan University sa Oslo. Right after that, I worked as a travel nurse sa Oslo University Hospital. And there was a period, there is 1 semester that I was working as a full-time travel nurse and a part-time clinical instructor and university teacher sa aking alma mater, which is Oslo Metropolitan University. It was a very fulfilling and exciting role as a teacher or as a clinical instructor sa isang bansang hindi nagsasalita ng English. So, after that, after 1 year of working as a travel nurse, I decided to take a postgraduate degree, which is the European Masters in Health Economics and Management. This is a joint master's degree of 4 different universities in Europe. So right now, I am actually here at Rotterdam in Netherlands, and I am taking my 3rd semester. And hopefully, matapos ko ang aking master's next year. Yun lang naman ang aking background. So to give you, oh yes, of course, as I mentioned earlier, I worked as a travel nurse at Oslo University Hospital, namely Aker Sykehus, Ullevål Sykehus, Radium Hospitala, and Riks Hospitala. So I was working at these 4 different facilities or hospitals that is under Oslo University Hospital. These hospitals are located at different districts within Oslo City or Oslo region. So yun, paiba-iba ako ng hospital at paiba-iba rin yung ward na aking pinagtatrabuhan for 1 whole year. To give you an overview of what's happening for the next few minutes, I will share you, of course, the ABCs of travel nurse. I will share you different experiences and scientific studies or research that involve travel nurses during COVID pandemic and a bit of my personal experience as a travel nurse. So ito ang ating pag-uusapan sa mga basic tungkol sa travel nurse. The boring stuff. I hope hindi kayo mabore. By definition, travel nurses are registered nurses that fill in temporary positions in healthcare facilities. They travel to different hospital, different healthcare settings in need of additional staff support. So, pwede sila ma-assign sa iba't ibang parte ng bansa o iba't ibang parte ng mundo. Na itong 1978 na to na nakalagay sa inyong screen is a very important date dahil ito ang first Mardi Gras celebration at ito rin ang start ng travel nursing. Why? Because during the time na nagkakaroon ng protesta sa Mardi Gras, the LGBT community was protesting for discrimination, for their rights. So dahil naging medyo brutal ang naging scenario during this celebration or this protest, maraming pasyente ang dinala sa hospital at marami din yung kailangang staff nurse. Kaya ang ginawa nila, kumuha sila ng mga import mula sa iba't ibang states, mula sa iba't ibang lugar papunta sa New Orleans sa Amerika. So ito ang start ng travel nursing, 1978. There are different types of nurse. In average, travel nurse will likely to work from 8 to 13 weeks. But of course, it differs depending on the contract or depending on you as a travel nurse. Like me, I work as a per diem travel nurse. It means na I choose one shift at a time. So before, magkaiba ang per diem at saka travel nurse. Pero ngayon, pinagsama na nila, nag-evolve at nagkaroon na ng panibagong role, which is per diem travel nurse. So, iba-ibang facility at iba-iba rin yung ward at pumipili ka rin ng trabaho mo one shift at a time. Next is the short-term travel nurse, which lasts less than 2 months. And ang mga example nito yung mga rapid response and strike nurse. Interestingly, sa Amerika, marami yatang nag-i-strike doon. So talagang may specific na role talaga ang mga short-term travelers, which is what they call strike nurse. Lastly, we have this long-term travelers, which lasts or ang contract na ito ay nag-start from 2 months to 12 months. Sa Amerika, bawal mag-exceed ng 12 months or 1 year according to my research. Bawal sila mag-exceed more than 12 months kasi tax-free ang kanilang sweldo at medyo magkakaroon ng complication pagdating sa tax system kapag sumobra sila ng 1 year sa isang lugar na hindi sila nagbabayad ng tax. But in Norway, what I experienced or my friends experienced, the one I met along the way during the time I was working there as a travel nurse, they were actually working more than 1 year. I met someone who worked as a travel nurse for 4 long years. Another classification of travelers is according to the location or area they are assigned to. We have the local, national, and international level or area. With the local, I have written here or I have included here in the slide different examples. First is within the states in America, and in Norway we have travel nurses moving within municipalities or within the municipality, city, or region. The next one is national level or national. We have travel nurses traveling between states or between municipalities naman sa Norway or within region, pwede rin. Within municipalities. Lastly, we have the international travel nurses. Of course, very common sa USA na ang mga Canadian nurses ay nagta-travel papunta sa US para magtrabaho. And sa Norway naman, it's very common to see Swedish and Danish travel nurses working in Norwegian healthcare facilities. So, mahirap lang kasi ang hirap intindihin ng mga Danish. Swedish, medyo madali-dali pa, pero Danish, napakahirap nilang intindihin. Now, if you are asking me what is the nature of work, I can say that travel nurses are not totally different from permanent staff nurses who are working in one particular area. I think the only difference that travel nurses are given with a degree of leniency when it comes to nursing responsibilities and expectations. They are also given, or travel nurses are given with a very short training program. And what I mean is yung, kunwari pagdating nila sa trabaho, especially kung 1 day lang or 1 shift lang sila magtatrabaho doon. So ang kanilang training is like maybe 15 minutes, 30 minutes, and then i-deploy ka na. So ang kinaibahan niya sa permanent nurses, ang mga permanent nurses, meron silang mga 6 months, 3 months na training bago sila actually magtrabaho as a nurse doon sa ward na yon. When it comes to nursing responsibilities, it's almost the same as permanent nurse. But as I've said earlier, merong degree of leniency. So, hindi nila masyadong ina-expect na sobrang alam mo na lahat at kaya mo nang gawin ang lahat. So, may possibility na bigyan ka ng 3 pasyente, tapos sila ang hawak nila 4 na pasyente. Pero kung medyo mas kilala mo na yung mga tao doon at medyo matagal-tagal ka na, or you work there several times, there is a possibility that they will treat you like ordinary permanent nurse. And of course, as a travel nurse, you are expected to work within your competence and specialization. So if you are working as an ICU travel nurse, you will work as ICU travel nurse. And if you work as a staff travel nurse, you will work as a staff travel nurse. And of course, drug administration, like any other nurses do. So on this slide, you can see my usual routine sa aking trabaho sa Norway. And yeah, it's almost the same, no? Pero makikita nyo lang difference nito sa Philippine routine is that we have morning care, which and morning care and breakfast and lunch. Kasi bilang nurse sa Norway, dahil nga konti lang mga nurses doon, we are expected to do everything. And their culture is that they don't have relatives that take care of the patients. So it's the nurse who will provide or assist the patients in morning care, preparing their breakfast, their lunch, and their dinner. Now, if you're asking me, what are the qualifications as a nurse to work as a travel nurse? To work in Norway, if you're coming from Nordic countries or if you are from European Union, these are the qualifications. But of course, we will skip this part. For non-EU citizen to work in Norway, first you have to have a Norwegian language proficiency test. You have to pass this exam, the B2 level exam, na nilalaman nito is yung reading, listening, writing, at saka speaking exam. So, kailangan maka B2 ka para ikaw ay makapag-aral ng supplementary education for non-EU nurses. Lagi yung aking sinabi. Nung sinabi ko nga kanina. So, yun ang isa sa mga requirements, yung Norwegian language proficiency para makapag-aral ka. And at the same time, para makapagtrabaho ka rin. Kasi kailangan mo talaga magsalita ng Norwegian sa Norway. Hindi kami nagsasalita ng English doon. And you have to have an employment contract of 80 to 100%. And that means, or that is equivalent to 29 to 35.5 hours per week. You need to have a work permit as well. Pero itong work permit na to, makukuha mo to once na meron kang employment contract of 80 to 100%. At syempre, kailangan mo rin ng Norwegian bank account. Of course, kapag ikaw ay permanent resident na ng Norway or ikaw ay isang citizen na ng Norway, hindi mo na kailangan ng employment contract na 80 to 100%. You can work as less as, well, at least 10% or wala yatang 10%, but yeah, at least 20%, yon. So, pwede ka na magtrabaho anytime as much as you want. At hindi mo na kailangan na work permit because you have the residence permit and the citizenship. And in order for you to work in USA, foreign nurses are required to have a BSN degree. NCLEX, kailangan napasa mo ang NCLEX. Of course, if you have passed NCLEX at different states, mas maging attractive ka sa mga employers. And they also looking for nurses with at least 1 year of clinical experience. And of course, credentials for specialization. If you want to work at ICU or ER or different special units within the hospital. So yun ang mga qualifications para sa ating mga Pilipino. Aside from technical qualifications, there are also qualities that travel nurse must possess. Number one is flexibility. It is very important na flexible ka sa time, na anytime na tawagan ka, because travel nurses are always on call. Every time they call you and they ask for your help or support, you must be flexible and you can adjust and you are comfortable for change. Kasi as a travel nurse, you work at different hospitals, different and work environment. You work with different people and different administration and systems. So flexibility is number one. Next is crisis management. Of course, maraming pagbabagong mangyayari and there's a possibility that there are some conflicts, stress, and crises that come up. So it's important for us as travel nurses to be prepared and to work independently then. Although not very independent na hindi mo na himingi ng tulong. Siyempre, kapag kailangan mo ng tulong, you have to ask your colleague dahil sila ang mas nakakalam, dahil sila ang nagtatrabaho doon sa lugar na yun permanently or for a longer period kesa sa'yo. And the next one is a broad clinical experience. Of course, having a broad clinical experience makes you more attractive for the employers. Team player. You work with team, and hindi lang siguro bilang travel nurse, pati ibang ordinary nurse ay kailangan team player ka. But I think the reason why I want to emphasize this because you are working, as I've said, working with different people. And in my case, I work with different nationalities, with different cultural and different culture and different background. So it was vital to have a team player attitude and skills para makipagtrabaho sa iba't ibang tao, na mayroong iba't ibang ugali. Last but not the least, high-tech experience. There's a possibility that you will be faced with different system or software or applications pagdating sa documentation. At least in Norway, sa aking experience, I encountered 3 different applications. We have for the hospital, we have for the nursing home, we have for the nursing home care, and aside from that, meron ka pang iba't ibang devices. You have the tablet, you have the computer, the desktop, you have also the mobile phone. So iba-ibang software, iba't ibang application, at iba't iba rin yung appearance niya. So kailangan magaling ka at mabilis kang matuto ng mga ganitong bagay. Kasi siyempre, you only have very short time, like I've said, very short training program pagdating sa mga bagay na yan. At kapag alam mo na yan, mas magiging madali na lang sa'yo. Sa umpisa lang, medyo mahirap. And for this last ABCs, I want to talk about career opportunities. Paano tayo makakahanap ng trabaho? We can find job through staffing agency. This applies for US and for Norway. So sa staffing agency tayo pupunta at doon tayo mag-apply ng work. Unless the hospital itself have their own bank staff. So yung bank staff ang pwede natin puntahan at doon tayo makakahanap ng trabaho. And from these agencies or from this point, we will be deployed to nursing home, nursing care homes, hospitals, or even vaccination centers. Oh, last but not the least, of course, within career opportunities, you would ask me why I work as a travel nurse, and it's only because of freebies. Of course, tax-free ang salary sa US, which range from $30 to $50 per hour. Sobrang laki. And I think it's almost the same in Norway then pagdating sa range. Medyo mas malaki lang talaga sa US. Mas malaki sa US. Lalo na nung COVID, sobrang taas ng sweldo ng mga nurses noon. Pero throughout the time, even before COVID, mataas na talaga ang sweldo ng mga travel nurses. Only because you are sacrificing your time and you are being paid because you are moving from one place to another, and you are paid for being flexible and for being available anytime na kailangan nila ng supplementary nurses or support. In US, they also provide free meals. Pero sa Norway, hindi provided yon. Pero provided sa amin, sa Norway and even sa US, ang housing or accommodation, free plane ticket mula sa bahay mo papunta sa location na magtatrabaho ka. And sometimes, kapag medyo mahaba yung kontrata mo, you are given an extra ticket for vacation. So pwede kang magbakasyon at sila ang magpo-provide noon. Last but not the least, you have the freedom for you to choose where to work, when to work, and who to work with. So yun ang napakaganda sa pagiging travel nurse. You might be wondering how call and response system works. Let me share with you what happens inside the hospital. A ward that is in need of a nurse or a staff will send a request to the staff bank. The staff bank, which has all the database, will connect this ward to different travel nurses. They will send a message or they will call. Naalala ko noon na sabi sa amin during the orientation, in just one click, they will they can send 2,000 messages or more than 2,000 messages sa more than 2,000 travel nurses na nagtatrabaho sa Oslo region. So ganun sila ka-efficient. Now, the call system ng staff bank na pinagtatrabahuhan ko, meron silang urgent, and that is yun nga, pagsasend ng text message, or sometimes they call as well, they call. Pero meron din kaming calendar of vacancies. In this way, they will put out different vacancies, and the travel nurse will then select or choose which shift they want to work. And then makakakuha sila ng confirmation. So yun, magre-respond sila. Of course, this response is binding. It means that you are obliged to report on duty. Wala nang atrasan kasi nag-yes ka na. Dahil nga, syempre, medyo mahirap maghanap ng trabaho or mahirap maghanap ng mga travel nurses. So talagang naka-bind ka doon. May mga consequence, at ang consequence is yung kakausapin ka ng leader, and then medyo masususpend ka ng siguro mga 1 week ganyan. Hindi pa naman nangyayari sa akin, pero one time nangyari sa akin na kinausap lang ako ng leader. Hindi pa naman ako na-suspend. And the call and response system is almost the same as in nursing homes. So the only difference is that instead of staff bank, nursing homes connect or they send a request to staff agencies, which connects and make contract with different travel nurses. So pwede silang per diem, short-term, or long-term. And of course, it's the same, binding then ang response ng mga travel nurses sa call or sa request ng mga staff agencies. So yun. I hope malinaw ito. Kung meron mang malabo, just ask me later or send me a message. Now, we're done with the ABCs of travel nurse. The next few slides, I'm going to share with you different studies, researches, and even a news article about travel nurses during or in the time of COVID. Let's begin with the first article, which discussed or mentioned that there was not just a COVID pandemic, but also an understaffed pandemic. At ang sabi raw dito sa article na to, there was a short-term solution, and that was hemorrhaging money. So literal na naglabas ng pera ang gobyerno, ang mga facilities, ang mga staffing agencies para lang mapunan itong understaffed pandemic. Dahil maraming facilities ang nangangailangan, marami ding at kakaunti ang mga travel nurses during COVID pandemic. Sobrang konti. Actually sa US, it says that only 1-point-something% ang nabasa ko sa isa sa aking mga research na 1-point-something ang percentage lang ng travel nurses sa buong USA. So talagang napakaliit lang. And because of this, these facilities will try to make or to offer a very competitive, a very attractive compensation para sa mga travel nurses. And because of this, nagtaasan lahat ng rates para makuha nila yung mga travel nurse na kakaunti lang. So, anong nangyari? Travel nurse became unsustainable, and it affect the healthcare system negatively. Dahil nga, syempre, tumaas yung presyo ng mga travel nurses. Sabi rin sa article na to, travel nurses are only cost-effective during outside pandemic. So, yun. Nung time ng pandemic, hindi siya ganun ka-cost-effective. Hindi nga, sobrang mahal. The second research was conducted by Fowler and her colleagues, and they used 2 different methods to assess the performance of the travel nurses in comparison to permanent nurses. It was found out that the quality of care and the patient satisfaction did not have any significant difference pagdating sa dalawang group of nurses na ito. So, nakakasabay ang travel nurses pagdating sa performance ng permanent nurses. And there were few significant findings that lack consistency and trend, but it was because of other variables not related to travel nurses or travel nursing. Raso and Fitzpatrick found or studied the different experiences of or perception of work environment ng mga travel nurse during pandemic. And they found out that travel nurses experience an authentic nurse leadership. So medyo unclear kasi ang system during the time ng COVID dahil sobrang crisis nga. But despite that ambiguity, the travel nurses experience authentic nurse leadership, which is a good thing. However, they experience poor work environment and the travel nurses' well-being was put at risk. Now, isinasuggest ng study na to or ng research na to that nurse managers should embrace travel nurses as core members of healthcare teams. So, in my experience, there were times na I felt like they were skeptic about travel nurses kasi syempre hindi nila ako kilala, hindi nila alam ang aking performance. But eventually, they realized, oh, magaling pala siya. So, sana lahat ganun, no? Sana lahat ganun. But okay, yes, like what this article is trying to imply is that nurse managers should treat us, travel nurses, at par with other staff nurses na nagtatrabaho doon permanently or for a longer time. Hansen and Tutas studied the live or work experiences ng mga nurses during pandemic. So meron sila mga iba't ibang mga motivators or indicators. But to make this short, they found out that there were physical and emotional trauma in early and peak months. And there were nurses who tried to reevaluate, or in the end, they thought of reevaluating their current work and consider job alternatives. At yung iba nga, di ba, marami nang nag-iba talaga ng career. Nag-terminate ng kanilang trabaho bilang nurse. Sadly. And this one is a news article in Norway. And let me just say, this is a very special case. This doesn't happen to everyone, not especially me. Venka Vik is a travel nurse in Norway, and her income for just 1 week after working overtime, she was able to earn 250,000 pesos. Ang laki, di ba? Grabe. Pero syempre, yun nga, overtime siya, tsaka that was during the time ng pandemic na sobrang kailangan talaga ng nurses. Pero isolated case to, hindi to nangyayari sa lahat. Pero may possibility. Siguro pinapakita lang dito yung possibility na pwede ka talagang kumita ng malaki as a travel nurse. And according to this article, the Norwegian healthcare is highly dependent on travel nurses. And these travel nurses, unfortunately, affects negatively the economy. And now, let me give you a summary of what we have discussed. Our roles as travel nurses have changed over time during pandemic. We became the bridge for the patient and the family. And I think this applies to everyone, any type of nursing, any type of nurses. And these added tasks and other tasks like being assigned to vaccination center or assigned to on one-on-one supervision, many nurses experience growth and others experience stagnation. Of course, no one knew how long the pandemic would last at hindi rin alam ng mga tao kung kailan matatapos yun. Dahil doon, maraming nurses ang naramdaman nila or na-experience nila na stuck sila sa isang bagay na parang wala nang katapusan. Another problem that we experience or very evident na crisis was the shortage of staffing shortage. And this is the reason why we have this talk. Travel nurses became the answer and the buffer. Kami or tayong mga travel nurses yung naging shock absorber. Hindi lang tayo naging sagot, pati tayo mismo nag-suffer sa problemang ito. And for this reason, we experience stress and burnout na to the point that people became absent, they took sick leave, and the worst case scenario, sabi ko nga kanina, there were people who decided to change their career. Another issue during pandemic was the ethical considerations. There was a question, an issue, whether the mandate on mandatory vaccination, is ethically justifiable. Of course, there were nurses who personally did not want to be vaccinated, but because of the mandate, because of the policy that was existing during that time, where hospitals, healthcare settings, healthcare facilities, and even the staffing agencies preferred vaccinated nurses over those who are not. So, malaking issue yon ng mga tao or ng ating society during ng pandemic. And I think medyo nangyayari pa rin siya until now sa iba't ibang part ng mundo. The last but not the least, we have to talk the big elephant in the room, and that is the low salary and the undervalued nursing profession. My topic for today is about travel nurse, a fulfilling role amidst staffing shortage brought by pandemic. But I can say not only that the pandemic has brought us shortage, but it also revealed the vulnerability of our healthcare system. So it only means that this staffing shortage is actually existing pre-COVID time. At pinakita lamang ng pandemic na to yung gravity ng ating ng crisis pagdating sa shortage ng mga nurses. Bukod doon, syempre, mababang sweldo and the treatment and appreciation na actually kulang mula sa iba't ibang sector ng ating society. Yon ang ating napagdaanan, ito ang ating mga na-experience during COVID in a nutshell. Now, of course, I hope you are interested to know about my stories as a travel nurse, and let me share you some things and tips and tricks and experiences that I had during the time na merong COVID. As I've said earlier, I worked at 4 different hospitals sa Oslo University Hospital, and during that time, na nagtrabaho doon as travel nurse, I worked there for 1 year and I was able to work at 21 different wards. So parang every day may regalo akong binubuksan. Like every time na I open my phone, I will check and it's as if I'm opening a present na hindi ko alam kung ano yung matatanggap ko that time. So it's either para bukas or para mamaya yung makukuha kong trabaho or shift. So, ganun yung aking routine noong time na yun. I was able to work at COVID assessment facility, COVID ward, infectious disease ward na meron kaming pasyente na merong COVID. Very exciting, dynamic, at saka punong-puno ng variation yung trabaho na to bilang isang travel nurse. Kasi nga, iba't ibang experience. And because of that, one of the highlights of working as a travel nurse, I happen to experience or to gain comprehensive but not specific clinical experience. So talagang na-experience ko yung iba't ibang mga trabaho dahil na-assign ako sa iba't ibang ward. For example, isang araw nasa medicine ward ako, the next day nagtatrabaho ako sa surgery, the following day tatrabaho ako sa plastic surgery, the next day naman nandun naman ako sa COVID ward, so nasa isang araw nandun naman ako sa rehabilitation ward, yun, or ortho ward. So iba-iba siya. So naging broad yung aking experience and even my knowledge, of course, and competence. But the downside of this is I was never an expert of something. Yun yung aking masasabing disadvantage ng pagiging travel nurse. But of course, advantage to kasi dahil may mga times na kailangan nila ng idea or ng tulong mula sa akin na nakakatuwa dahil for example, may na-assign ako sa isang post-surgery transplant ward, yeah. Na kailangan nila na meron yung mga katrabaho ko that time, they had no idea what they would do sa VAP or VAP. So I told them that I have experience working or using VAP, so maybe I could help. And then yun nga, natulungan ko sila sa part na yun. And it came to me na isang magandang realization. May mga bagay na hindi ko alam, na alam nila, pero may mga bagay din naman na alam ko na hindi nila alam. And I think this is one of the strengths of, or one of the disadvantage ng pagiging travel nurse. Pero syempre, we work as a team, and I think maganda lang na meron tayong kanya-kanyang contribution para sa ikauunlad ng bansa. Next, another highlight of my experience as a travel nurse is that I was able to receive different job offers. During the time nagtatrabaho ako doon, hindi sa pagmamayabang, kaliwat kanang offer ang aking natatanggap to work permanently sa mga wards na aking pinagtrabahuhan. But at that time, I had to refuse because I had other plans. And naalala ko nung nag-apply ako doon bilang auxiliary nurse, hindi nila ako tinanggap. So sabi ko, huyo kayo sa akin ngayon. So sabi ko, no thank you, pero meron akong ibang plans as of now. And at that time, I was enjoying the experience of working as a travel nurse. Another highlight na talagang sobrang gusto ko sa pagtatrabaho bilang travel nurse is that I can choose which shift I want. And I never worked as a night shift. I never worked on a night shift. Kasi nga, I really hate working night shift. The pay is good. Yes, you get to have, you'll have extra payment if you're working on night shifts. But of course, night shift is not for me. So I refuse to work night shift. Another highlight is that I was able to expand my network. I'm happy to say that I have friends or acquaintances at different hospitals na napuntahan ko, and I was able to build relationship and build good network mula dito sa mga tao ito. And I'm happy na talagang nakita nila na masayang kasama ang mga Pilipino, laging masaya, at talagang we always give our best. At hindi tayo nakatanga lang. We always take the initiative, at yun ang gustong-gusto nila sa atin. Talagang love na love talaga tayo ng mga iba't ibang lahi. And another highlight is that I was infected by COVID. Medical professionals in Norway were prioritized during vaccination time. However, travel nurses were the least priority within the healthcare sector. I don't know for what reason, pero talagang hinuli kami sa lahat. Inuna muna yung mga permanent na nurses. Libre naman siya, wala namang bayad eh. So talagang, hindi ko alam kung bakit kami hinuli. Pero dapat ninuna kami kasi paikot-ikot kami, di ba? Pero nahuli kami. And because of that, na-infect ako ng isa sa mga pasyente ko. At pagkasakit ako ng 1 week, 10 days, and I was paid. So paid ang aking sick leave. Yun ang maganda sa Norway. Paid ang iyong sick leave. Kahit na travel nurse ka pa. Of course, the last but not the least, there are two important highlights ng aking experience. Yun ang freedom to do everything, dahil talagang gusto ko yung freedom na pwede ako magtrabaho anytime na gusto ko magtrabaho, and even choose where to work. Kasi may mga talagang ward na hindi ko feel, hindi ko gusto magtrabaho, at iniiwasan ko, so hindi ako pumupunta doon, parang ganon. So nakakapili ako kung ano yung gusto kong trabaho, even the person I want to work with. Kasi syempre medyo choosy na tayo kapag medyo matagal-tagal na tayo nagtatrabaho, no? So umpisa kinukuha mo lahat, pero in the end, eventually na-experience ko na namimili na ako. And of course, naging part ako ng isang malaking history sa humankind, and talagang it is an honor to serve and to offer my service to the people in need during the time of COVID pandemic. And I will never forget every time na may mga pasyente na they lose hope, and the only hope and the only person that they could talk to were nurses on duty. So talagang kakaibang experience, very rewarding ang experience na makapagtrabaho ka during the time ng COVID. And I will never forget that. Yes, this is the end of my presentation. Thank you everyone for listening. I hope that you have learned something from this talk. And if you have any comments, suggestions, feedbacks, or inquiries regarding travel nursing, or simply would like to connect, I have here my email address, LinkedIn account, Facebook account, and my WhatsApp number. Later this evening, you'll be given a chance to raise questions, and I hope that I can make it, that I'll be present during that time. But if not, send me a message and I will try to answer them as soon as possible. Medyo busy lang sa school, but certainly magre-reply ako. It has been an honor for me to be a part of this seminar. Thank you everyone for your participation, for all the organizers, and I wish you all the best and God bless. Goodbye.